Welcome back to Medic Talk, everybody. Today we are doing a deep dive on syphilis.
That's right.
And syphilis has been kind of a silent stalker
It has.
throughout history, and it's a tricky one,
Yes, very much so.
full of unexpected twists and turns.
Absolutely.
But we're going to unravel its secrets today
We will.
and arm you with the knowledge that you need to ace those exams.
Yes.
And maybe even share a few mnemonics along the way.
That's right. Syphilis is really a classic in infectious diseases.
Okay.
It's caused by a bacterium called Treponema pallidum,
Okay.
and it has a knack for disguising itself.
So it's like a master of disguise in the microbial world.
Absolutely.
Interesting. I bet there's some fascinating stories about how this bacterium was discovered
Oh, there are.
and how our understanding of syphilis has evolved over time.
Absolutely. The history of syphilis is as fascinating as it is complex.
Okay.
For centuries, it was shrouded in mystery and stigma.
Wow.
It wasn't until the early 20th century that scientists finally pinned down the culprit,
Oh, wow.
Treponema pallidum.
Interesting.
And before penicillin, the treatments were pretty rough,
Oh, really?
often involving mercury.
Wow, mercury. Talk about a cure that's almost as bad as the disease.
Right.
But at least it shows how far we've come in terms of treatment.
Right.
Now we've got penicillin,
Right.
a true game changer.
Absolutely.
Speaking of treatment, let's talk about how syphilis actually unfolds in the body.
Okay, so syphilis progresses in stages.
Okay.
Think of it as a play in 4 acts.
4 acts. Okay, I'm already picturing this in my head. Set the stage for us.
Okay.
What happens in Act 1?
Act 1 is all about the entrance of the chancre.
Okay.
A painless sore that pops up at the site of infection, usually around 2 to 3 weeks after exposure.
Okay.
Now, this chancre can be sneaky. It might be tiny and easily missed,
Oh.
especially if it's tucked away inside the body.
So you could be infected and not even realize it. That's a bit unnerving.
Yes, you could.
Yeah.
But eventually, this silent actor takes center stage, right? What happens next?
Right. Act 2 brings the drama.
Mm-hmm.
This is where we see a rash.
Okay. Not just any rash, but one that can cover your entire body, including the palms of your hands and soles of your feet.
Wow.
You might feel like you've got the flu.
Okay.
Fever, fatigue, muscle aches, the whole shebang.
Okay, so now we've got a full-blown production.
Right.
A rash covering your entire body. That's definitely not something you can easily ignore.
Definitely not.
But then what? Does the play end there?
Not quite. Even if the symptoms vanish after a few weeks, the bacteria are still lurking backstage, setting the stage for Act 3, the latent stage.
Latent meaning hidden.
Yeah.
So go undercover. But for how long?
That's the tricky part. Latent syphilis can last for years, even decades.
No, wow.
During this time, the bacteria are silently wreaking havoc, damaging organs like your heart, blood vessels, and even your brain.
So it's like a ticking time bomb. You can be walking around feeling fine,
Yes.
but unknowingly facing some serious long-term consequences.
Exactly. And for about 20% of people, the final act, Act 4 tertiary syphilis, takes the stage. This is where the long-term damage becomes devastatingly clear.
Okay, I'm getting chills just thinking about it.
Yeah.
What kind of damage are we talking about here?
Think major organ dysfunction, aneurysms, heart valve problems, neurological disorders like dementia and paralysis.
Oh, gosh.
It's a stark reminder of why early detection and treatment are so crucial.
Definitely a sobering thought. So we've got these 4 acts, each with its own unique set of challenges.
Right.
But what about transmission? How does this sneaky bacterium get around?
Primarily through direct contact with a syphilis sore during sex, vaginal, anal, or oral.
Okay.
But here's the thing. Even if there are no visible sores, transmission can still occur, especially during the secondary stage when the rash is present.
That's quite concerning. So it's not just about visible sores. It's about understanding that bacteria can be present even when symptoms are subtle or absent.
Precisely. That's why it's crucial to be aware of your partner's sexual history, practice safe sex, and get tested regularly if you're sexually active.
Regular testing, got it. Now let's clear up a common misconception. Can you get syphilis from casual contact, like sharing a drink or using a public toilet?
No, syphilis isn't spread through casual contact. It's transmitted through direct contact with the sores or rash of an infected person.
Okay.
So you don't have to worry about catching it from toilet seats or sharing utensils.
That's a relief.
Hmm.
But speaking of transmission, we can't forget about a particularly vulnerable group,
Right.
pregnant women and their babies.
Absolutely.
Our sources mentioned congenital syphilis, which sounds pretty scary.
It can be.
What exactly does that involve?
Congenital syphilis occurs when the bacteria cross the placental barrier during pregnancy, infecting the developing fetus.
Gosh.
It can have devastating consequences for the baby, including stillbirth, premature birth, and a range of health problems later in life.
Wow, that's heartbreaking.
Mhm.
It really emphasizes the importance of prenatal care and screening for syphilis during pregnancy.
Yes.
So let's talk about those screenings. How is syphilis diagnosed?
Diagnosis usually involves a blood test.
Okay.
There are two main types, non-treponemal tests and treponemal tests. Okay.
Non-treponemal tests, like the VDRL or RPR, detect antibodies your body produces in response to the infection.
Oh, okay.
If these tests come back positive, they're usually confirmed with a treponemal test, which specifically targets antibodies against Treponema pallidum.
Okay, so two types of blood tests working together to confirm the diagnosis.
Right.
Makes sense. But you mentioned that syphilis can be tricky to diagnose.
It can.
What are some of the challenges?
Well, the early stages of syphilis can be asymptomatic.
Okay.
And even when symptoms are present, they can mimic other conditions,
Oh.
leading to misdiagnosis.
Right.
Plus those non-treponemal tests we talked about. They can sometimes produce false positive results,
Oh, really?
particularly in people with certain autoimmune disorders or during pregnancy.
So it's not always a straightforward diagnosis. It sounds like it requires a careful clinical evaluation and a combination of tests to get an accurate picture.
Exactly. And that's where the expertise of a healthcare provider is crucial. Yeah.
They can interpret the test results, consider the patient's medical history, and determine the most appropriate course of action.
This has been super informative, but before we move on to treatment options, is there anything else about transmission we should cover?
Just one more important point. While sexual contact is the primary mode of transmission, there's also a rare possibility of getting syphilis through direct contact with an active sore, like during kissing.
So while rare, it's not impossible. It's a reminder that any contact with infectious lesions can be risky. Okay, now let's shift gears and talk about the good news treatment.
Okay.
What's the go-to option for syphilis?
Penicillin is the gold standard for treating syphilis.
Okay.
It's highly effective, especially when administered in the early stages of the infection. It works by interfering with the bacteria's ability to build its cell walls,
Okay.
essentially causing it to self-destruct.
Okay, so it's like sabotaging the construction crew of the bacterial fortress.
Exactly.
But penicillin comes in different forms, right? Is there a specific type used for syphilis?
Yes, good question. For syphilis, we typically use benzathine penicillin G.
Oh.
It's a long-acting form that's given as a single intramuscular injection for early-stage syphilis.
Single injection. That's pretty convenient.
Yeah.
But what about those later stages we talked about where the bacteria have got into hiding?
Right. For those, we might need multiple injections, usually spaced a week apart. And if syphilis has reached the nervous system, we'll administer intravenous penicillin for a more aggressive approach.
Okay, so it sounds like tailoring the dosage and the delivery method is key to effectively combating syphilis at different stages.
It is.
What about those who can't tolerate penicillin? Are there alternatives?
There are, but they're not as ideal. Doxycycline is an option usually given orally for a couple of weeks. However, it's not recommended for pregnant women due to potential risks to the developing fetus.
That makes sense. So it's crucial to discuss any allergies or sensitivities with your doctor to determine the safest and most effective treatment plan.
Absolutely.
Now let's address something that might be on our listeners' minds. What happens after treatment? Is syphilis a one-and-done deal?
Unfortunately, no. Even after successful treatment, there's a chance of reinfection if you're exposed again.
Oh,
That's why it's so important to practice safe sex and get regular checkups.
so it's like a lifelong commitment to vigilance.
It is.
You can't just assume you're immune once you've been treated.
Yes.
Speaking of vigilance, let's revisit congenital syphilis for a moment.
Okay.
You mentioned it can have devastating consequences for babies.
Yes.
Can you elaborate on what those might be?
Sure, babies with congenital syphilis might experience a range of health problems, from skeletal deformities and vision problems to developmental delays and even seizures.
Oh, wow.
In some cases, it can be fatal.
That's truly heartbreaking.
Yeah.
It really underscores the critical need for prenatal screening and early treatment to prevent these tragic outcomes.
Absolutely. Early detection and treatment are paramount.
We've covered a lot of ground here, from the historical context to the biological mechanisms, transmission, and treatment.
Yeah.
But what are the key takeaways for our listeners,
Okay.
especially those aspiring healthcare professionals?
Well, firstly, syphilis is a master of disguise, mimicking other conditions and often going unnoticed, especially in its early stages.
Yeah.
This makes understanding its subtle cues and progression crucial for accurate diagnosis.
So being a medical detective looking for those hidden clues is key. What else?
Secondly, syphilis has a long and complex history, reminding us that medical knowledge is constantly evolving.
Right.
What we know today might change tomorrow, emphasizing the need for continuous learning and staying updated on the latest research.
Always be a student. Right. Never stop questioning and seeking new information.
Exactly. And finally, syphilis reminds us that health is not merely an individual concern, it's intertwined with social, historical, and cultural factors.
So here-
Understanding the broader context is vital for effective healthcare practice.
It's about seeing the whole picture, not just the symptoms. That's a powerful takeaway. Now, before we wrap up this deep dive, any final thoughts for our listeners?
Just a reminder that knowledge is power when it comes to health. The more we understand about conditions like syphilis, the better equipped we are to protect ourselves, our patients, and our communities.
Well said. This has been a fascinating and thought-provoking deep dive into the world of syphilis. And as we always say on Medic Talk, stay curious, stay informed, and stay healthy.
Absolutely. See you in our next deep dive.
Okay, we've covered a lot of ground on syphilis, but before we wrap up, I want to touch on something that we haven't explicitly discussed yet,
Okay.
and that is the social stigma
Right.
associated with STIs.
Yes,
And it's something that can prevent people from seeking testing or treatment.
absolutely.
And it's definitely something we as future healthcare providers need to be mindful of.
Very much so. It's a major barrier to effective prevention and control.
Right.
It can lead to feelings of shame, fear of judgment, and reluctance to disclose sexual history, all of
Yeah.
which can hinder early diagnosis and treatment.
Exactly. And that stigma can be particularly pronounced for syphilis,
It can-
given its historical association with moral judgment and promiscuity.
Absolutely. It's important to remember that anyone can get syphilis,
Right.
regardless of their background, lifestyle, or sexual orientation.
Yeah.
It's a bacterial infection just like any other,
Yeah.
and it deserves to be treated with the same medical objectivity and compassion.
So how can we, as future healthcare providers, combat this stigma and create a more supportive environment for our patients?
It starts with education.
Okay.
We need to be well informed about STIs, including syphilis,
Right.
and be able to communicate that information to our patients in a clear, non-judgmental way.
So that means using inclusive language, avoiding assumptions,
Yes.
and creating a safe space for patients to ask questions and share their concerns without fear of judgment.
Exactly. We also need to advocate for policies and practices that promote STI testing and treatment access,
Okay.
reduce barriers to care, and protect patient confidentiality.
So it's about creating a healthcare system that is truly patient-centered, and that prioritizes the well-being of all individuals.
Precisely. And it's about recognizing that STIs are a public health issue, not a moral one.
Right.
We need to shift the conversation from blame and shame to prevention, education, and compassionate care.
I think that's a powerful message to end on. Syphilis, like any other medical condition, requires a holistic approach that addresses not only the biological aspects, but also the social and emotional well-being of our patients.
Couldn't agree more.
This has been an incredible deep dive into the world of syphilis. We've explored its history, its biology, its social implications, and the importance of compassionate care.
It has been. It's been a pleasure sharing this knowledge with you and our listeners.
Thank you.
Remember, as future healthcare providers, you have a crucial role to play in destigmatizing STIs,
Right.
promoting early detection, and providing evidence-based, patient-centered care.
And to our listeners, thank you so much for joining us on this journey. We hope you found it informative and empowering. Remember, knowledge is power when it comes to health. So stay curious, stay informed, and stay healthy. Until next time.
Bye.